Health is extremely important to older Italians, but their approach to keeping healthy may be based more on cure than prevention. God willing is a common expression you may hear when older Italians discuss their well-being. Often Italians feel more comfortable visiting the hospital rather than their doctor when they are ill. This is because they feel the hospital can provide more of a thorough analysis of their illness. They may look for specialists and highly regard their opinions, but may consult only a few of them to verify a correct diagnosis. Many may submit to any required tests, but might prefer to get these done at the hospital. Some may feel that allied medical services, like physiotherapy, speech therapy, acupuncture or counselling, aren't as effective as prescribed medicines, but they'll give these therapies a go if their family, friends or doctor insists. The older generation of Italian Australians are more likely to suffer health problems arising from lack of regular exercise or the lifestyle they've chosen to follow. When Italian men retire after having traditionally held jobs involving heavy labour, such as farming, bricklaying or concreting, they see their retirement as the time they have earned to relax. Exercise may be seen as work, and some may fail to appreciate how beneficial it can be. Italians tend to display the same health conditions as many other people with Mediterranean ancestry. Diabetes and obesity are more common in older Italian women than men. Because their perspective on health is more curative than preventative, it is common for older Italians to avoid routine health examinations until they feel unwell. Nowadays, they are facing up to more regular preventative tests, such as mammograms, monitoring of sugar levels and blood pressure, but pap smears and prostate checks are not common. Many older Italians will commonly ignore symptoms of an illness as they believe it's only a matter of time until they are well again. Usually they will only see a doctor if the symptoms persist. They are fearful of mental illness, depression and psychiatric problems and know little about these conditions. There is still a strong stigma attached to such afflictions within the elderly Italian community. Older Italians may express and describe their pain openly and expect you to share their concern. So it's important to acknowledge that you understand how they feel and reassure them. When in pain, they're reluctant to be left on their own to deal with it. Having their loved ones around to provide physical and emotional support is vital to their recovery. If your client is in pain and hasn't told anyone, comfort them and ask if they'd like you to call someone from their family to come. Some older Italians can be very superstitious. One of their common beliefs is malocchio, or in English, the evil eye. Part tradition and part superstition, the evil eye is a curse, sometimes unintentional, placed by someone who is jealous or envious of another family or good luck. According to the belief, this curse then manifests itself as misfortune, usually in the form of an illness or financial woes. It's more common for southern Italians to believe in the evil eye. Older Italians fear cancer, and if someone in the family is dying from it, many families will opt not to tell them. Family members strongly believe that telling the truth will cause their loved one to give up hope and lose the will to live. It is important to be sensitive when talking about cancer and to know what choices the family has made about telling the affected person. Euthanasia is strongly condemned in the Italian culture as it is seen as going against the will of God. In communicating on sensitive health issues, it's a great advantage for a carer to be bilingual. By not understanding the treatment for some illnesses and being reluctant to receive health services, older Italians may be taking medication but not receiving other supportive treatment like physiotherapy. It is challenging for a carer to encourage a client to seek out other available health services, but may be easier if you can give them information in their own language. Back this up by giving the same or more information to younger family members in English so they can talk over the options with your client later.